basic medical services, because after COVID, we just felt, okay, we cannot just sit down and just see people passing through here to the airport and then go to other countries to access service. We should be able to provide those services here. So in light of all of this, currently we are warming up to start kidney transplant in Federal Medical Center, Abuja, which we intend to do routinely. And with the support of the National Assembly, I think in this year's budget, we're going to have funding to expand on our dialysis services and also get some equipment that will support the kidney transplantation services. In terms of training, we have residency training programs that are going on in various departments in the hospital. And it's good to note that at present we have produced so many specialists that are currently giving service not just in FMC, not just in Nigeria, some are giving services elsewhere. We see them as our ambassadors. Likewise, we have several in-service trainings. A lot of our staff, we encourage them to update their knowledge through part-time programs and other research, and many of them have seized the opportunity to improve on their knowledge. In terms of research, we have several collaborations currently that are going on, and most of them, they are on diseases that commonly affect us, and we want to know more about them, the peculiarity, and how interventions can be done to improve upon. Now, in terms of challenges, I think we have had interaction with the chairman even before now. The challenges are quite, it's just similar to every other institution. Number one is issue of energy. I think the cost of energy is really pulling us down. Most of our inflows, which are basically funds from contractors that provide us with consumables, drugs, and other things, we use most of this fund to pay for power, either AEDC or buy diesel. So we spend quite a lot on power, and it's affecting us negatively. Other areas is we need more support in terms of improving funding so that we can get requisite equipment and do all the procedures that we see being done to the best of places in this global economy. Thirdly, if you look at this hospital, you see that it's quite chopped up. We have inadequate space for expansion. Even in terms of parking, we have to meet FCDA to even give us somewhere across the road where we are currently encouraging our staff and other patients to go and park and then walk in to access service. The influx of clients here is quite much, and it increases by the day. This is Abuja. A lot of people come in. Like I always say, around 2020 when I came in here, the patient load was just around 5,000, 6,000 in a month. Now we are getting closer to 30,000 in a month.
So I'm delighted to be here to have a one-on-one interaction with the management team of the hospital, the Federal Medical Center, Abuja. This is my second visit to this hospital. So let me say this in a hurry that I'm grateful to the hospital for taking care of me sometime last 2 months. I'm also here to report progress. That your patient is recuperating. So I was here and the hospital took care of me. So thank you very much. So first hand, I can say that if you treat other Nigerians like you treated me, then we're making progress. I had a first-hand experience of medical or dental health care, and I want to commend the hospital. I was very strategic in also using my third eye to see other things. I went to where you dispense drugs from, and I looked around. I saw the kind of drugs in stock, and I was impressed. And the neatness of the place. Sometimes you go to hospitals and everywhere is smelling. So I paid attention to those things. But I'm sure you didn't know that. I also checked other things like that. In about 2 hours that I spent here, I was careful not to even let people know who I was. And I was able to also interact with the staff. The course extended was such that I was very impressed and I had a good impression of the hospital. Now, I am the chairman of health institutions today by the indulgence of the Right Honourable Speaker, and our mandate as a committee is to ensure that we support the tertiary health institutions to improve healthcare service delivery in our country. A lot of our medical doctors are scoring in droves. Some even go to West African hospital, and it's a big shame. It's a sad commentary that we're losing doctors every day, not to death, but they're migrating. There's no restraint to trade. That's true. We all have rights to go to anywhere we want to go to earn a living, but we should be able to improve our conditions, and we should make it a better place for all of us. For the patients, the patient should say, oh look, we have improved service delivery in the health sector. For the doctors, the package should also be something what they take home should actually take doctors home. And then our own evaluation or assessment of the institutions should be such that we should partner with these institutions to reduce medical tourism so that we can achieve even more.
And all of us should be working together because we are working to achieve the same purpose. And we must let the government and whosoever know that health is not a fund yielding. It's not, you invest in the health of your people in order for them to become more productive. You are going to gain it elsewhere, not directly from the health institutions. So let them understand that, and let the accountants too, let them realize that if you can't begin to take the money that you didn't invest in, you must be able to separate your investment and the return on investment. It's the return on investment that we should be sharing, not the capital as well as the result of investment.